Dave and I always had a dream of opening up our own clinic. We both worked for different hospital systems for over a decade, and we wanted something different. It's very important for us for patients to come in that they feel at ease and they feel cared for, and they're not just a number. All our staff are in line with our values, where we treat patients like family, and we try to go above and beyond for each individual in the specific ways that they need it. At first, we thought it was just a pipe dream. I am very thankful and blessed to say that we have made it a reality. Thank God, we are growing and we're able to help patients with all the ENT medical needs and be a service to our community.
If there's something that's bothering you in the head and neck, you'll probably start by seeing your primary doctor. That's a great place to begin with anything. And then if there's any concern or any issue at that point, they'll have you come and see us within ENT so that we can figure out the next steps and what to do to care for that problem.
Here at ENT Family Clinic, we see patients of all ages, pediatric to geriatric.
So some of the things that we see are hearing loss, sinus problems, difficulty breathing through the nose, sleep apnea. With kids, we'll have often chronic ear infections or tonsil infections. Those are some of the things that we see frequently.
It's super easy to book an appointment. We have a fully equipped reception team that are available to take your call and to book you. If it's easier for you to email, you can do that as well, and our reception team will reach out to you when it's most accommodating.
Most important thing that we can do is just talking to the patient, just understanding what they've been experiencing, what's going on with them, what their symptoms are. Then we'll do a physical exam. Of course, we'll look in the ears, we'll look in the throat and the nose. Sometimes we'll do a camera or a scope to look deeper in the sinuses or down into the vocal cord area. We can also do a CT scan or allergy testing to get a deeper idea of what's triggering some sinus or nasal complaints. We have a range of tools and interventions that we can do, but we tailor it to each patient to make sure that they're getting just the care that they need.
We have a full reception team that are available and willing to help all patient needs. We also have a patient portal where you're able to log in and enter all your demographic information before coming into your appointment to make it smoother and quicker. You're also able to get patient test results and visit notes on there as well.
So after a certain procedure is done, we'll give very clear instructions that patients know exactly what to expect afterwards, exactly how things will go. They always have a way to contact us in case of emergency. And so we really make sure that people are comfortable getting from the procedure that's done until we make sure that they're fully recovered.
Chronic rhinitis is characterized by inflammation of nasal mucosa causing excessive mucus secretion, congestion, nasal itching, and sneezing. The nasal nerves regulate functions of the nose such as mucus secretion. It has been shown that interrupting the pathways of these nerves results in the reduction of nasal symptoms, including rhinorrhea and congestion. Over 10 million people in the United States alone suffer from chronic runny nose and congestion symptoms, a condition called chronic rhinitis. Oral and intranasal steroids and antihistamines are typically the mainstays of medical treatments, but they require daily use and can carry side effects. About 2.5 million patients do not respond to these medications or get satisfactory relief. Clarifix is an innovative cryotherapy device designed for use by ear, nose, and throat doctors for patients who suffer from chronic rhinitis. The cryotherapy procedure with Clarifix is safe and office-based, with minimal pain and discomfort. It only requires local or topical anesthetics and could provide long-lasting symptom relief. Physicians use the Clarifix device to deliver freezing temperatures to the back of the nose after proper anesthesia. The cooling time takes just a few minutes. A clinical study demonstrated that the Clarifix device was safe and delivered significant relief of chronic rhinitis symptoms with minimal downtime and recovery. Clarifix, a breakthrough technology for people with chronic rhinitis.
Hi, my name is Michelle Shabib. I've been coming to ENT Family for about a year to do allergy shots. I initially came in for itchy ears. They gave me oils, and then I did the allergy testing, and then I started doing the allergy shots, and ever since then it's been great, and I haven't had itchy ears, I haven't had to take Zyrtec, nothing. When the medical team was telling me about my treatment plan, they were very thorough, and they explained to me everything that was being done. The atmosphere has been amazing, and they've all been very welcoming. I highly recommend coming to ENT Family if you have any allergy issues or itchy ears.
Audion is Stryker's new eustachian tube balloon dilation system, featuring flex field technology. Before dilation, visualize to ensure there are no occlusions or a patchless eustachian tube. Enter with the transnasal approach, with the device tip up or slightly rotated towards the patient's ear. Then track along the nasal floor to the opening of the eustachian tube. Place the ball tip of the Audion device along the superior portion of the opening and enter approximately 10 millimeters. Next, advance the balloon. Using the atraumatic flexible tip of FlexField technology, position the device about 20 millimeters into the eustachian tube, stopping when the blue to gray transition is at the opening. The device features a 45-degree angle that serves to provide a positive stop that avoids critical anatomy. To begin the dilation, slowly inflate the balloon, then push the inflation lock forward. This will ensure 12 atmospheres of pressure are maintained for the 2-minute dilation. After 2 minutes of dilation is complete, deflate, retract the balloon, and remove the device in the same orientation it was placed. Audion is a simple ET dilation solution.
My name is Jemias Bozeman. What brought me here is I had major nasal pollens, 8 on one side and 9 on the other one. I had surgery, Dr. David removed it. Ever since, I've been breathing normal like a champ. As you can see, it's wonderful. I just breathe so good and better than I thank God. The ENT Family atmosphere is great, they're wonderful. I come there every 2 weeks now to get the injections to keep the pollens from coming back. The care that they have for you at their clinic and the things that they do for you, they make you feel well. They're just nice and generous, and if I have any questions or problems, they let me know what is what and help you in every way they can. And they're just a great ENT family, they really are.
Allergen immunotherapy, acting at the core of the allergy process. Respiratory allergies often cause symptoms that affect the nose, eyes, and throat. These symptoms occur when the allergic patient is in contact with a foreign substance to the body, called an allergen, harmless to most people. Allergy negatively affects daily life, leading to disturbed sleep, fatigue, absenteeism, and poor performance at work and at school, as well as having an impact on everyday or leisure activities and social relations. Why are we allergic? An allergy is an overreaction of the immune system in contact with the allergen. The reaction takes place in 2 phases. The first phase is the sensitization phase. Upon initial contact with the allergen, the immune system considers the allergen as an enemy substance. The cells in the immune system, macrophages and lymphocytes, interact. Lymphocytes produce antibodies specific to the allergen, which bind to other cells known as mast cells. These mast cells are then sensitized to the allergen. The second phase is a reaction phase, which takes place when the allergen is encountered again. The mast cells sensitized to the allergen recognize it immediately and release inflammatory substances to mobilize the immune system. These inflammatory molecules are what cause allergy symptoms. Respiratory allergy is a hereditary progressive chronic disease that, untreated, worsens. Patients sensitive to an allergen often develop sensitization to other allergens over time. Allergic rhinitis may lead to onset of asthma. Can we modify the allergic reaction? There are two types of allergy treatments for treating allergies. Symptomatic treatments, prescribed as first-line treatment to relieve symptoms. Allergen immunotherapy, also known as desensitization, the only treatment to act directly on the cause of the allergy. Based on the same principle as vaccination, it consists of gradually and regularly administering the allergen causing the symptoms to patients in order to induce tolerance to the allergen. How does it work? Allergen immunotherapy reaccustoms the body to the presence of the allergen and rebalances immune response. It reduces allergy symptoms or even causes them to disappear altogether. It can also prevent sensitization to other allergens and the onset of asthma. By acting directly on the cause, only allergen immunotherapy can offer a long-lasting effect. Only allergy specialists are able to assess relevance of allergen immunotherapy. Specialists first of all conduct an allergy assessment, which involves clinical history taking, in-depth diagnosis by skin tests, and blood tests where applicable, to determine which allergen the patient is sensitive to. Allergy specialists prescribe the most appropriate treatment on the basis of the patient's allergy assessment. Allergen immunotherapy can be administered in two ways. The sublingual route, common today, whereby patients at home place drops of a solution or a tablet under the tongue. The subcutaneous route, whereby patients in a medical environment receive regular injections. Who can benefit from allergen immunotherapy? Allergen immunotherapy is indicated in subjects with allergic rhinitis or mild to moderate asthma, where symptomatic treatments are insufficient. It can be started as of the age of 5 years. When to start allergen immunotherapy? In the case of seasonal allergies, such as pollen allergy, the treatment can be started a few months before the start of the pollen season and continued during the pollen season. The treatment can then be discontinued and started again the year after, following the same protocol. In the case of perennial allergies, such as allergies to dust mites or animal hair, the treatment can be started at any time of the year and it is taken continuously. For long-term efficacy, the treatment must be taken for at least 3 years or 3 consecutive seasons. Allergen immunotherapy, by acting on the cause of the disease, reduces allergy symptoms as of the first few weeks and improves the quality of life of allergy sufferers.
Hi, Mr. Bozeman. How are you?
Hey, Marinelle, how are you doing today?
I'm doing good, thank you. So I know I'm going to be giving you Dupixent today. How are you feeling with your nasal and your sinuses right now?
I feel great. They've been doing everything, been doing great for me.
Okay, good. So I know that this is your second dose for the month, so we are going to be ordering more for you. So when you come back, your doses should be ready.
Don't scream and send it, okay?
No, I'm not going to scream.
Just wiping in the back.
That's right what she gave it to me.
And then you go here, and then like this. Okay, you're all set, Mr. Bozeman.
Right, well, thank you.
You're welcome. So when you go to the front, just let Liz know you need to come back in 2 weeks.
Okay, no problem. Thank you, okay?
I'm Pamela, and this is my daughter Shira. And we came to ENT Family as Shira was having continued ear infections and strep throat. Our experience at ENT Family was always very honest. From the very beginning, we knew exactly what Dr. Elif wanted to do, what the expectations were, and the staff here was very kind with Rachel and everyone, especially the ladies at the front. ENT Family stands out from other clinics, I think, and Shira's even mentioned it, that they actually care. You know, they've called, followed up after any type of procedure, asked how she was feeling, where sometimes at other places you feel like you're just in and out and they're not really there to improve the issue.
How do you feel now after surgery and not having strep throat infection soften?
I felt good and I felt like I wouldn't get them anymore. When I was at the hospital for surgery, I felt safe.
The Express ENT dilation system provides lasting relief for many patients with sinusitis symptoms. Chronic sinusitis is inflammation of the sinus cavities. Those who suffer from chronic sinusitis may have nasal congestion, facial pressure, and a decreased sense of smell interfering with their quality of life. 1 out of 8 adults in the United States suffer from chronic sinusitis. If you've experienced these symptoms or have recurrent acute rhinosinusitis, speak with your physician about whether balloon sinus dilation, a minimally invasive sinus procedure, could be the relief you need. The Express system for balloon sinus dilation procedures enables physicians to dilate sinus openings and pathways, which can provide relief from discomfort or persisting symptoms. The device is indicated to treat 6 sinuses, 3 on each side of the body: the frontal sinuses, the maxillary sinuses, the sphenoid sinuses. To treat the sinuses, a small balloon is inserted into the opening of the sinus. The balloon is then briefly inflated to dilate the sinus pathway, then deflated and removed to restore drainage of mucus and help resolve sinus symptoms. For more information, speak with your physician to address your questions around chronic sinusitis and the Express ENT balloon dilation procedures.
What does an ENT doctor do and what health issues do they handle?
So ENT doctors see a range of things related to the head and neck. We see problems with ears, hearing loss, difficulty breathing, problems with the sinuses or throat trouble, difficulty with their voice, all sorts of things you can imagine with the head and neck, cancer and non-cancer. And people will come with a variety of issues or things that they're experiencing, and we'll help them figure out what's going on and how to get them to the next step and how to get them better.
What treatment options exist for allergies?
So here at ENT Family, we offer allergy treatments for patients who have environmental allergies. They're either injections or oral, known as SLIT or SCIT. SLIT is sublingual immunotherapy and SCIT is subcutaneous immunotherapy. The injections are once weekly for the first year and then monthly after that. And for the oral, it's twice daily for 2 to 5 years, depending on the severity of someone's allergies.
What options do you offer for treating sinus infections?
When it comes to sinus infections, we're going to start with the least invasive options first. So we're going to start by just trying some antibiotics, trying some nasal sprays. And we have an algorithm and a method to try to help people get their chronic sinus problems better without requiring surgical intervention. So we're going to start with maybe an allergy test and a scope to look at their sinuses, maybe a CT scan. And eventually, if we need to, certainly there's non-invasive or minimally invasive options that we can do, like a balloon sinuplasty or an operative sinus surgery. But the first, second, and third things that we're going to try to do is help this patient without operating if we can, because I think that's what every patient deserves.
What are the treatment options available for ear infections?
For ear infections, it depends on whether we're talking about a chronic ear infection or an acute ear infection. And again, we're going to make sure that we're treating the patient with the least invasive options first. So we're going to first just see if we can get some antibiotics or some simple treatments. But if it's something that's an ongoing issue, we're going to have other options that we can do, whether it's an ear tube or other interventions to get them fully better.
What options do you offer for treating hearing issues?
So for hearing loss, depending on the type of hearing loss, we need to first figure out whether it's a problem with the nerve or a problem with the sounds getting all the way into the nerve. And that can be as simple as ear infections or wax, or it could be as complex as injury to the nerve of hearing itself. And so we use some different tools to decipher which one it is, a hearing test, and eventually we can offer some solutions for hearing loss depending on what the source of that problem is.
What options do you offer for treating throat pain?
So for throat pain, we would start by understanding how long it's been a problem for, how long it's been bothering somebody, and what seemed to trigger it. Sometimes we can figure out the cause pretty easily. It might be something that they swallowed or got stuck in their throat, or it could be something that's been going on for a while. And so again, after a physical exam and after we get the history from the patient, we'll probably do a flexible laryngoscopy where we put a camera through the nose so we can look at the throat. We use some numbing spray in order to make it more comfortable, and patients tolerate it quite well. And it gives us an ability to look inside the body so that we can see what's causing the problems.
My name is Joseph Bornstein. I'm a professional singer, Chazan. My voice was just hoarse and scratchy, and I felt uncomfortable. I had to get some help in order for me to be ready to perform in our synagogue. So I came in over here, and Dr. Elif was so wonderful, so warm, so beautiful. He listened to me, he takes his time, and he checked my vocal cords and put in a camera, and he determined what the problem is, and he gave me some medicine, and it was wonderful. I came on the bima in the synagogue, and I was able to reach a high C, clearly, with no problem. The voice was just clear and ringing well, and I was very, very appreciative to the treatment. His diagnosis was just perfect. Dr. Elif and his wife are wonderful people, and they're just beautiful to work with. And I recommend anyone who is looking for a good ENT office, a doctor, and help should come here. It's wonderful, wonderful to be here.
$60 million and growing. That is the number of allergy sufferers in the United States. More than 17 million, the number of patients who will visit their doctor annually complaining of allergies. And there's an increase in the number of emergency room visits and urgent care encounters related to serious allergy suffering. You can now treat the cause and not just the symptoms of allergies. The Allergy ENT core product is a broad diagnostic percutaneous skin test for 70 of the most common environmental allergens in the U.S. There are no needles, and the Allergy ENT testing process is pain-free. There's virtually no waiting for test results. Results are available within a 15 to 20 minute period, and this testing method has sensitivities greater than 90%, with very low to almost zero adverse reaction risk. Skin tests are more sensitive than serum blood tests, and when compared, result in lower false positive rates. Allergy ENT is needle-free, virtually pain-free, and safe for even very young children. Results are available in 15 to 20 minutes, no waiting for lab tests to come back. Adverse reactions are extremely rare, and no near-fatal or life-threatening reactions have been reported for this type of test. Allergy ENT is easy for your staff to administer, and patients who test positive to allergen triggers can now be offered allergen immunotherapy treatment, either through the use of subcutaneous shots or the more convenient sublingual drops.
We wanted to start ENT Family in order to create an environment where patients can be seen as individuals, where we can really care for people, not in this big hospital environment. Of course, Rachel and I are family, we're married. She's the nurse practitioner, I'm the doctor. But in addition to that, we wanted to treat our employees and our patients as family as well. So that's really important that everyone be able to come in and feel like they're being cared for, just like family.
Since opening our clinic, we have been fortunate enough to build strong relationships with our patients and our staff, becoming more than just an ENT practice. If you ask us, what is ENT Family? We would tell you that.
ENT Family.
ENT Family.
ENT Family.
ENT Family.
ENT Family is healing.
ENT Family is a happy place.
ENT Family is genuine care.
ENT Family is passionate.
ENT Family they're a great family. They like my family now.
ENT Family is kind.
ENT Family is devoted.
ENT Family is my home.
ENT Family is the best.
ENT Family is really a family. Dr. Elif and his wife are wonderful people, and they're just beautiful to work with. And I recommend anyone who is looking for a good ENT office, a doctor, and help should come here. It's wonderful, wonderful to